Good day to you viewers. Welcome to our very first edition of Health Talk, and I will be your presenter, Ayuba Tete. And with me I have the resident doctor of community medicine, Dr. Mohammed Abdul Darma. You're welcome to the program.
Thank you very much.
And with Dr. Mohammed, or is it Darma? Dr. Darma. Dr. Darma, I will be discussing something that has been recurrent in our community and in the country as a whole. I'm talking about Lassa fever. A lot of people do not understand this disease, and that is what we are trying to shed more light on today as regarding its symptoms, its causes, and of course, its prevention. So without any further ado, Dr. Darma, please we would want to understand the disease or the endemic called Lassa fever.
Good day to our viewers. Now, Lassa fever is an acute febrile illness which belongs to a group of diseases called viral hemorrhagic fevers. Now, these diseases, as the name implies, are a group of diseases which are caused by viruses, and they primarily present with bleeding, which is hemorrhage, and also fever, distinctly fever. Now, specifically, Lassa fever is caused by the Lassa virus. And Lassa fever is a public health concern for us here in West Africa, because it is present in countries such as Guinea, Sierra Leone, Liberia, but the highest burden of disease is here in Nigeria. Historically, Lassa fever was not known prior to the 1960s. Now, in 1969, there was a case whereby two missionary nurses contracted an unidentified febrile illness, which caused their unfortunate death. And this occurred in a village called Lassa in Borno State, Nigeria, present-day Borno State. And then after samples were taken in the United States, it was identified that a certain virus caused it, which was named Lassa due to the location where the deaths happened. Now, Lassa fever usually occurs throughout the year. But we usually have outbreaks during the dry season. That's between the months of November to around April and May. So you see, it's a major problem in Nigeria, and it's a major problem in West Africa. So that's just the background of Lassa fever.
Thank you very much for that enlightening introduction to the disease. Now, it seems in our country, there's some sort of like a reoccurrence. It seems as if, okay, it has been contained, then all of a sudden there's another outbreak. Why is that the case exactly?
Now, we can relate this to the cause of Lassa fever. Lassa fever is caused, as I've said, by the Lassa virus. But the question is, how does the Lassa virus get into humans? In West Africa, we have a certain animal, a rodent, that is very common in our environment, called the multi-mammoth rat. Now, the multi-mammoth rat is the reservoir for the infection, for the virus, meaning that it is that animal that carries the virus. It is the animal that carries the virus, but the next question is, how does the virus get into humans? Now, there are three ways whereby the virus can spread into humans. Firstly, there could be direct contact with rats. Direct contact with the rat, either its urine, its feces, its blood, its saliva, any other body fluids in the rat is what contains the virus, and then the virus can be transmitted when you have direct contact with the virus. Secondly, there could also be contact with any objects or any surfaces or materials, household utensils, which the body fluids or the blood or the feces of the rat has touched.
Yes.
For example, you have spoons at home, plates, utensils,
yes.
and the rats touch them. And when you use those things, you have a high risk of contracting the virus.
Okay.
And then also food. Food, as we know, food is very vital to the life of animals. We have to eat. So specifically rodents, they have the propensity to try and eat things that are kept in maybe bags or sacks. So when rodents try and eat these things, they might give saliva or blood or even feces in our food stuff. And when this is eaten, the virus can also be transmitted. And then thirdly, person-to-person transmission. Person-to-person transmission of the virus. Now, when somebody is infected with the virus, the body fluids of that person can also transmit, can transmit the virus to other people. So, I think when you look at our environment, when we don't take care of the surroundings, when we don't have a good process of environmental sanitation and making sure things are clean, the rats increase in number. And when the rats increase in number, the risk of having also increases. Yes, having the virus also increases. Okay. So basically that's it.
Okay, so for clarity's sake, one thing is for sure, Lassa fever is not airborne.
It's not airborne.
Okay, because of course we have seen situations where they try to quarantine those infected, yes, and it seems as if it is airborne because of all the protective...
yes, the reason why we have those personal protective equipment is because the person that has Lassa fever has a high risk of transmitting it to another person through those fluids. Okay. Now, so there's a need for healthcare workers and also individuals to protect themselves. And that's why we always advocate for people to keep their environment clean and also to have good hygiene practices.
Okay. All right. Secondly, it's been rather difficult finding someone who is infected and, of course, treating that person accordingly before it breaks out. It's actually at maybe the tail end of the full breakout that we finally find out, oh, this person has Lassa fever. So what are those initial telltales, those symptoms that people should look out for before it now becomes well, hard to control or maybe uncontrollable?
Severe, yes.
Yes.
I think one thing that we should note about Lassa fever is it shares a lot of symptoms with other febrile illnesses.
Definitely.
For example, malaria. So the fact that Lassa fever has those non-specific symptoms, that is why it is usually difficult to diagnose in the beginning. Now, some of those signs and symptoms that patients present with originally fever, headache, sore throat, cough, nausea, vomiting, muscle pains, chest pain, and the distinct one that is seen in viral hemorrhagic fever, specifically Lassa fever, is unexplained bleeding. Now, individuals could bleed from the nose, from the ears, from the mouth, from the anus, and from anybody opening. So these are some of the signs, some of the symptoms that the patients present with. So that usually when a health worker meets patients like this, they usually have a high index of suspicion that this person might have Lassa fever.
Okay, all right. And as regarding, because it seems, please correct me if I'm wrong, but it seems there's a high propensity of getting Lassa fever in like rural areas and underdeveloped areas. How, why is that the case?
Well, for underdeveloped or, as you said, rural areas, they have a lot of practices that make their environments to have a high risk of being able to be breeding grounds for the rats. For example, poor disposal of refuse. For example, poor storage of food. When you have situations whereby we have something in our environment, even in the urban areas, whereby people try to store food by drying it in the open.
Yes.
You know, people can keep okra, meat, fish, pepper, and they will keep it in the open. Now, that open drying increases the risk of contamination from the rats.
Okay.
You know? And also other things like poor hygiene practices. You know, usually simple things like hand washing. In areas where you don't have running water,
yes,
the risk of contamination of food is increased. So in our environment, there's always a need to make sure that things are clean and people imbibe good practices so that you limit the risk of contamination.
Okay. I will jump the gun because, of course, you know, we are talking about the symptoms now and how they present themselves. And I would just want to ask, for now, and especially since you are in community health, what are the measures that have been put in place to inform the people? First of all, we won't talk about preventive measures here, but what are the tools that have been put in place to inform these people who are in the rural areas?
A very simple one is this interview right now.
Okay.
The media is very important in trying to create awareness. You know, both new media and old media. But if we're talking about the rural areas, old media, like radio.
Okay.
When you're listening to the radio now, you'll always be hearing jingles where they'll be telling people about making sure that their environments are clean, making sure that their food is well stored, you know, good practices of hygiene. So, firstly, the media is very important. Now, the Nigerian Center for Disease Control is also doing very well. They are also putting a lot of news on Lassa fever, on the outbreak. They are also trying to educate people. They're releasing a lot of public advisories, so that, and a lot of people are also going into the communities firsthand and meeting people and explaining to them what the disease is, what the symptoms are, and what are the steps to take. Now, for example, in the local governments, there's also, every local government has a disease surveillance and notification officer, DSN. So these officers are usually the first link between the communities and the health centers in the communities and also the central authorities. Yes. So they also try to, as much as possible, to report cases, suspected cases. Because further, when we're talking about how to diagnose it, you understand that there's a need for there to be a link between taking the samples and trying to test them to see if these cases are actually cases of Lassa. So these are some of the measures that we're taking. Awareness is very important because the prevention of Lassa is attached to awareness of individuals.
Well, forgive me, but let's talk statistically now. Has there been a decline, and if there has been, you know, if you could give us some figures so as to be rest assured that things are actually being controlled as much as possible, especially by the authorities you just mentioned?
Well, the last report, situation report, released by the Nigerian Center for Disease Control, that's on the 19th of January, shows that we've had 163 cases so far this year, 2020, and we've had 24 deaths, unfortunately. But the truth is, trying to prevent, trying to control the disease is also attached to trying to statistically measure how many cases we've had. Because you know, the total number of cases have to be confirmed that they are really cases. Of course. You do have some negative cases. But at present, the situation report is we've had those number of cases and a few deaths. but a lot of effort is being done in trying to control the outbreak, the present outbreak that we have.
Okay. Viewers, you are still tuned in to Health Talk, and I'm your presenter, and I've been discussing with Dr. Darma as regarding Lassa fever, its symptoms, statistics regarding how it is being controlled by the organizations involved, and now we're going to talk about the preventive measures, especially from an individualistic point of view. So, Dr. Darma, what would a regular homeowner, a regular citizen do to prevent this scourge of Lassa fever?
I think firstly, as I've already mentioned, environmental sanitation is very important. Making sure our houses are clean and the environment generally is also clean. Because dirty environments serve as a breeding site for the rats. They serve as a magnet for them. So as much as possible, making sure your houses are clean, making sure you clean any stagnant water, making sure that there's proper disposal of waste, proper disposal of refuse. For example, now when you go to a lot of houses, you see open dumping of refuse, or you see dustbins that are lidless, no lid, no cover. So making sure you cover refuse at home, and then very importantly, storage of food. Okay. Now, food storage is vital, as I've already explained, due to transmission of the virus. Now, when it comes to storage of food, it's better to store food in rodent-proof or rat-proof containers.
Okay. Are there such things, or just any plastic will do?
Well, a lot of people now, if you go to the market, you can buy the big drums that have lids.
Okay, yes.
Sometimes if you put rice or you put beans inside, it's good to go.
Okay.
So as much as possible, it's better to store food in rodent-proof containers.
Okay.
And also making sure that where you store your food, there are no holes or any avenues for rats to enter, or any other vermin to enter into where you store your food.
Okay.
And also making sure that as much as possible, when you cook, you have to cook food properly. Make sure your fruits are washed, your vegetables are washed, your condiments are washed, and the food is cooked properly, so that it's not eaten raw. And also making sure that good personal hygiene. Because as I mentioned, part of transmission of the virus, there's also transmission on surfaces and other objects.
Oh yes.
Objects could be clothing, could be bedding, it could be utensils. So making sure that you wash your hands regularly, because if you touch surfaces that
may have come in contact
you could get the virus. So making sure good hand washing under running water and soap. And then also, very importantly, people that have symptoms, some of the symptoms that I've mentioned, should make sure that as much as possible they present to hospitals early. We have the tendency to want to self-medicate. Yes. In this environment, yes, people like to self-medicate. You just stay home, you take a few pills, and you say you're okay. Or people like going to the local patent medicine store, commonly known as chemist.
Yes.
So people would like to go there to take drugs. So as much as possible for us to be able to know, to suspect Lassa fever, the patients have to present to the hospital. So that we don't have any lost cases outside. So people should present to the hospital, come early, because Lassa fever itself is not a death sentence.
Okay.
There's a treatment for Lassa fever, but the treatment is more effective, and the rate of survival is much better when patients present early.
Yes.
And the treatment is called ribavirin. It's an antiviral drug that is given either orally or intravenously to treat Lassa fever. So these are some of the things that even people that we tell to go to the field, to the communities, these are some of the things that we need to tell them. Because sometimes they store food improperly, and this increases the risk of contamination.
Okay. All right. You mentioned self-medication, and I was getting there. I'm talking as a layman now. Most people, for instance, your everyday malaria, for instance, you are encouraged to at least
go to the hospital.
Go to the hospital, but it may be too late. So, is there any sort of medication one can take preventively before they get to the hospital, or do you?
There's no medication one can take before you come. Okay. Everything has to be in the nearest health facility.
Okay.
Because there's always the need to test whether the person actually has Lassa fever.
Okay.
Now, when it comes to diagnosis of Lassa fever, those symptoms that I've mentioned are the first thing that we use to suspect.
Okay.
Alongside history of either contact with the rats, infected rats, or contact with a person who was either suspected to have the disease or confirmed to have the disease.
Okay.
Then the confirmation of the disease itself is done by laboratory testing. We take blood samples, and there are certain tests that are done to detect the virus in blood before somebody can be confirmed to have Lassa fever. So you see that person stays home and says, oh, I'm going to take drug A or drug B.
Yes.
There's no way to confirm that the case is actually Lassa fever or something else.
Okay. All right. Okay, still on medication, is there a known vaccine to prevent, just like we have meningitis, polio, and the like? Is there like some sort of preventive vaccine?
Unfortunately, at this point, no. There is no vaccine to prevent Lassa fever. But as we say, prevention is better than cure. There are other ways of preventing Lassa fever, as I've said. But for a definitive or a vaccine that will prevent Lassa fever and Lassa fever, we still don't have one, unfortunately. Yes, but I know scientists are still working on that. Definitely. We hope in our lifetime we'll still have possibility of having a Lassa fever.
Inshallah. Okay, thank you very, very much. And to round up our discussion, could we have an idea of what is being put in place for the future to, of course, prevent future outbreaks from your department, of course, which is public health, and then the country as a whole? Some preventive measures that are being put in place, or that will be put in place in the very near future.
Yes. Regarding the steps taken, just yesterday there was a meeting, an infection prevention and control meeting, hospital meeting, at the level of the entire hospital, and a lot of steps have been taken, a lot of measures have been itemized for us health workers to be able to take the right decisions in controlling the outbreak. So for us, personal protective equipment, proper channeling of information and reporting from the field, so that we'll be able to detect whether a person actually has it and be able to transmit information. And then at the level nationally, now the Center of Disease Control is working very hard to make sure that they will take the right decisions in making sure that the Lassa fever outbreak is controlled. Yes, there was also I know in Kano State there was some cases in Aminu Kano Teaching Hospital, and from them they've also taken measures and steps to see how they can control the outbreak.
Viewers, thank you for being with us, and of course along with Dr. Dharma, we have been talking about Lassa fever, its symptoms, its preventive measures, and what the doctors are doing, and of course the health establishment as a whole is doing to prevent further outbreaks. I hope with these few minutes we have discussed, you are enlightened and you know more about Lassa fever and how to control it. And remember, once you already have certain symptoms of Lassa fever, please do not hesitate, do not self-medicate. Go to your nearest health center and have your be tested for Lassa fever so as to prevent any further outbreak. Thank you very much for watching. I have been your presenter, Ayuba Tete, and we will see you next week with another very enlightening program here on Health Talk. But for now, goodbye.